In this video, we're going to take a look at the variety of different ways that drugs can be administered to a patient. So, when choosing or selecting a method for drug administration, it's going to depend on many different factors. So, first off, it's going to depend on the chemical nature of the drug. So, is it polar, non-polar? That's going to really affect how we get the drug into the human body. It's also going to depend on the condition of the patient. So you can't have a patient swallow a pill if they are unconscious. So you have to consider those factors as well. And then finally, also, what's the most effective way to get the drug to the target organ? So taking something orally may not necessarily be the most effective way. So looking at some of the different ways, here are all of the different ways you can take a drug. The first one is oral, so that's taken by mouth. Those are things like tablets, capsules, pills, liquids, your typical Tylenol or Advil or any of those sort of medications. Another way is inhalation. So this is breathing in vapors or smoking. So can be things like asthma medications, can be nasal sprays, nicotine, so smoking, or even some of our narcotics like cocaine. Skin patches. So this is where you directly apply a skin patch to your skin. And so it's absorbed directly from the skin into the blood. So things like estrogen or nicotine patches this is a great way that these are used. Suppositories are inserted into the rectum. Very sort of typical example there is treatments of hemorrhoids. This is very, very effective. You can also have eye or ear drops, which is liquid that's directly delivering the medication to that particular opening. So used quite often in ear and eye infections. And then finally, perineedle, which means injection. And there's sort of 3 different levels of injection. The deepest one, intramuscular, is used for vaccines. Intravenous is the fastest method of injection, and that's for anesthetics. And then subcutaneous is dental injections. So what do these 3 actually mean, and what do they look like? So taking a closer look at perineedle or injection administration, if this is outside our body and this is inside our body, then subcutaneous just means just underneath the skin. Sub means under, and then cutaneous means skin. So needles injected just underneath our skin. Intravenous is going into the veins. So intra means within, and then venous means veins. And then intramuscular is the deepest. And so that's going within your muscle. So they're going right into your muscle in your arm usually, and that's where the injection happens. Finally, I did say that we did have to consider the chemical nature of the drug, and this has to do a lot with the bioavailability of the particular drug. And so what is bioavailability? Well, it's the fraction of the administered dosage that's absorbed into the bloodstream and reaches the target part of the human body. If you're injecting intravenously, that's the only time you have 100% bioavailability. Other routes of administration typically will decrease that bioavailability, and that will depend on the solubility of the compound, on the polarity, as well as the presence of certain functional groups. So as we're taking a look at various classes of different medications and drugs, we're going to take a look at these different factors because they are very, very important to determine the bioavailability of a drug or medicine. So we've looked at various different ways of how drugs are administered in the body. That's it for this video. We'll see you in the next one.